Hi everyone, it's me, Melanie, your IVF nurse, and this video is going to be about progesterone injection tips. So, progesterone injections, there are a few forms: cottonseed oil, sesame seed oil, castor oil, and then more recently there is a new compound base of ethyl oleate. So your progesterone is made in these bases. Now, because it is an intramuscular injection, you will need 3 ml syringes as such to do your injection. Depending on your oil base, you may have needles that are given to you that you will draw out the oil with, and then you'll inject with a needle as such. So a 22 gauge, which is on this 22 gauge 1.5 inch needle, would be used typically for those that are doing injections with sesame seed, cottonseed, or castor oil. The ethyl oleate can be injected with a 25 gauge 1.5 inch needle. So keep that in mind. If your clinic has that available for you, then that's definitely an option. It's still the same length. It's 1.5 inches because it's got to go into the muscle, but it's a little bit smaller in terms of the diameter of the needle that's going into you. But intramuscular injection, 1.5 inch needle. So this is what's going to be going into the muscle. The injection sites for this are usually in the upper outer quadrant. My preferred spot where you would see, I think nurses usually do this because patients aren't too comfortable with doing it, the ventral gluteal. Some tips for doing the injection: you're going to apply a cool compress. Please make sure that the ice is not directly on the skin. Do wrap it in a towel before applying it, but you would apply it for about 10 to 15 minutes prior to the injection. It kind of numbs the area. Once you do the injection, after landmarking, you can massage the area, which is recommended, despite the oil base that you're doing, for 2 to 3 minutes after the injection has been completed, and then a warm compress afterwards. So same thing, about 10 to 15 minutes after the injection has been done. Some nurses will say to do it after the injection. I usually recommend doing it multiple times throughout the day. So if you're sitting down, reading, eating, watching TV, if you've got 10 to 15 minutes to put a warm compress on your backside where you've been doing your injections, then your body will thank you in the long run. The normal side effects from doing the progesterone injections can include bruising at the injection sites, tenderness, especially for those that are doing them for approximately 12 weeks. Usually after the first week or so, you can start to get really tender or sore. Some of the more severe reactions that I've seen are itching at the injection site. That tends to expand in the area. And when you break out in hives, that's another situation that may be going on where you're developing an allergic reaction, possibly to the oil base. So those are things you would need to let your clinic know about. They may either change your oil. Say if you're taking say you're doing cottonseed oil, they may switch you to sesame seed oil or ethyl oleate to see if that helps reduce the reaction you're having. Now, some of the more severe reactions is when it becomes red, raised, hot to touch. Sometimes that can be leading to what we call cellulitis. So you do want to be contacting your nurse if you're thinking that this is a possibility that you've developed, or if you're having just a reaction that you don't think is normal. Reach out to your nurse, have an appointment made, get in and see her to show her your site so that she can relay it to the doctor, or even if you're able to get into the doctor, to have them eyeball your sites to make sure you're either doing it correctly, or if you need to treat a condition from a reaction you're having, change your oil. Those are all important things. I hope you found this video helpful. Please feel free to email me at yourivfnurse@gmail.com. You can check out my website, www.yourivfnurse.com. You can follow me on Instagram at yourivfnurse, or you can subscribe to my YouTube channel. Comment down below. Thanks for watching.